class, my name is Olivia Murphy, and I am going to be demonstrating how to complete an oral DNA MyPeriopath diagnostic salivary test in this video. This test is used to determine the species of bacteria that are found in our patient's oral cavity. If these bacteria are pathogenic in nature, they may be harmful to the patient's systemic health, and they may be leading to the exacerbation of cardiac events in patients, arterial inflammation, and along with periodontal disease. It is important for our patients to be aware of the bacteria that are present in their oral cavity, as it is very important for their overall health. Dr. Thomas Neighbors created this test because he felt that the traditional modality treatments for periodontal disease were only treating the disease in the mouth. However, there's research showing that the bacteria in your mouth does travel systemically through the entire body and can lead to cardiovascular disease. Okay, I hope you enjoyed this presentation and you learn a lot. Thanks. Okay, so here we have our patient who I will be demonstrating the oral DNA test on. This patient suffers from periodontal disease, and that was determined through full mouth probing and pocket depths above 4 millimeter pockets in all 4 quadrants. There was more than 30% of bleeding on probing and signs of inflammation. I initiated this test because it is important for us as clinicians and the patient to be aware of the possible effects of this bacteria affecting her systemic health as well. So, okay, so this is the test that we will be completing. And this is a saline solution tube that my patient will swish with for 30 seconds. So I will have my patient swish vigorously for 30 seconds, and once that 30 seconds is up, she will expectorate into this tube here. So I'm going to have you swish for 30 seconds with this, and I'll put a timer on for you. So you can go ahead. And I'll take this, and when you're done, you can spit into that one. Okay, you can expectorate. Perfect. Thank you. So once the patient has expectorated into the tube, you want to remove this top funnel piece and dispose and replace with the red plastic top. Okay. And then there is a preservative solution that needs to be put into the tube before you send off to the lab. So you can put the preservative solution into the tube here. And you can close a final time completely. The patient's name and date of birth will be written on this sticker here. It will be placed on to this tube here. The tube is then put into this bag here, and it is packaged back into this box and closed. I'm here to explain the rest of the process to you. Once the test is collected and the saliva sample is packaged into the box again, the clinician will put the test into the FedEx bag that is provided with the test, and a shipping label is printed off of the Oral DNA website. This can only be completed if the clinician has an account with Oral DNA. Once the Oral DNA lab receives the sample, it generates a final report. You can see on my screen as I'm sharing with you that this is a sample report that is given, and this would reflect the report that you would receive from one of your patients. The patient information is located on the top left, and you see a bar graph here. Oral DNA characterizes bacteria into 3 categories: high risk, moderate risk, and low risk pathogens. We are most concerned with the high risk pathogens. These black lines indicate the threshold level for each bacteria. The level of bacteria should not exceed this threshold level. If it does, this raises a red flag for the clinician and for the patient that there is too high of a presence of this bacteria, and it could be posing a high risk for a cardiovascular event. If you continue on, the Oral DNA lab provides treatment considerations. Sometimes it's just mechanical debridement, and sometimes it does include systemic antibiotics. Each patient's results will vary. Continuing on, it gives the patient's specific details and the reason for testing, clinical findings, diagnostic periodontal findings, and the patient's medical history. This information is input when you create the report. The patient can then match the bacteria that were found above the threshold down to this chart here. Each bacteria found are associated with different systemic problems. And for the purpose of this video, I will focus on the cardiovascular health. And this summary states that these certain bacteria, AA, TD, TF, PG, PI, and FN, are responsible for a patient's cardiovascular health. It states that these bacteria can incite inflammation in arteries and, if occluded, cause a heart attack. A goal of treatment is to minimize the level of these bacteria as much and as long as possible. And that is also our goal as clinicians, and that is the main reason that we do complete this test with patients. I hope you learned a lot. Thanks.